Implants for dental purposes have become an increasingly popular choice for those seeking to restore missing teeth. Implants provide a longer-lasting and natural-looking option as compared to bridges or dentures. However, how effective are dental implants? In this short video, we'll explore the rate of success for dental implants and the factors that affect their effectiveness. For starters, let's clarify what a dental implant is. Dental implants are tiny titanium pieces that's surgically implanted into the jawbone as a replacement to the tooth's root that is missing. After the implant is installed, a crown will be placed on top of it to complete the repair. Implants for dental purposes are renowned for their longevity and durability and can last for a long time when properly maintained and cared for. What is the overall percentage of success for dental implants? Research has shown that dental implants can have an average success rate of 95–98%. The high rate of success is because titanium, which is the main material that is used in dental implants, is biocompatible and melds seamlessly with jawbone. This creates a sturdy and solid foundation that the implant can be connected to. Furthermore, advances in technology and methods for dental care has improved the effectiveness of dental implants through time. There are a few elements that could influence the effectiveness of dental implants. One of the most important factors is the general health of the person. People with health issues like diabetes or immune-mediated diseases could have less success with dental implants. Smoking also has a negative impact on the rate of success for dental implants, as smoking can slow the process of healing and raise the chance of failure. Another aspect that affects the rate of success for dental implants is the position that the implants are placed. Implants that are placed on the face of your mouth, in which there is a higher bone density and less strain to the implants, are likely to be more successful rate than implants that are placed behind the mouth. Experience and expertise of the dentist who performs the surgery plays an important part in the successful placement for the implants. Maintaining proper oral hygiene and maintaining proper maintenance is essential to the longevity for dental implants. Patients should follow the dentist's guidelines for taking care of implants. This includes regular brushing and flossing and also attending regularly scheduled dental examinations. Inadequate care of dental implants could lead to problems such as infection or failure of the implant. Dental implants are highly successful with a rate which is between 95 and 98%. But there are other aspects like overall health, smoking habits, the implant site, and experience with the dentist which can affect the effectiveness implant placement. If properly maintained and cared for, implants are able to offer a lasting and natural alternative to missing teeth. If you're considering getting dental implants, make certain to speak to an experienced dentist to find out if you would be a suitable candidate for this procedure.